Hi guys, today Adam and I are going to talk to you about the examination and risk factors for patella tracking issues and dislocations.
The introduction, the patella moves or tracks in the groove of the femur. The patella tracks in a C formation, not in a linear formation. Abnormal or poor tracking is caused by functional and structural deficiencies. Poor patellar tracking can also be caused by trauma to the knee or repetitive stress.
So I have some statistics here that I found. 15% of knee injuries are due to sport injuries. The most common sports that have poor tracking issues are runners, basketball, football, gymnastics, soccer, and tennis. There are a lot of issues associated with poor tracking, and they're most always due to repetitive stress, such as jumping or running.
Some non-modifiable risk factors when it comes to patellar tracking issues is the patella alta, which is the high riding patella, a patella that's on the femur. Frog-eyed patella, that's when the patella has a lateral tilt to it. Squinting patella is when the patella has a medial tilt towards it. Patellar baja is when the patella is riding low on the tibia. Increased Q angle, that's the relationship between the femur and the tibia. And then just to give you some numbers, men greater with 14 degrees of a Q angle has or have more risk of patellar tracking issues, and then women greater than 17 degrees have greater issues or have a greater possibility of patellar tracking issues. And then miserable malalignment, and then a shallow femoral groove can also be some risk factors that you cannot modify.
All right, some modifiable risk factors are being overweight or obese. There's also a lot that has to do with having tight muscles and weak muscles, which you can always strengthen the weak muscles and stretch the tight muscles. So having tight quadriceps and weak quadriceps, especially having a weak VMO and it having a slower reflex time than the vastus lateralis. Having a tight IT band, overuse or overloading the knees, such as I said earlier with the jumping activities or running. A weak gastroc, weak gluteus medius, and as I also said before, repetitive stress during running or jumping activities.
Normal patella tracking. The normal tilt for the patella is lateral when the knee is extended, and then the medial tilt occurs between 0 and 30 degrees of flexion and greater than 100 degrees of flexion. The lateral tilt occurs between 30 to 100 degrees of flexion.
So as we said in the introduction, the patella tracks in a C shape. So it goes from lateral, medial to lateral tilt while it goes through the range of motion. Other aspects of the normal tracking of the patella are the rotation. There's a medial rotation and a lateral rotation. The rotation looks at the inferior pole of the patella. So to have medial rotation, the inferior pole of the patella moves medially with the tibia as it moves into internal rotation, and vice versa with lateral rotation. The inferior pole of the patella will move laterally as the tibia moves into external rotation. There's also a glide feature to the patella, and the medial glide occurs during the knee flexion, and then the lateral glide occurs with knee extension, coming back to the lateral, medial lateral as it moves through the range of motion.
Some other patella tracking issues. Chondromalacia patella is caused by poor tracking, and that results in compressive forces and repetitive friction to the patella bone. McConnell's CMP mechanisms include a high Q angle, tight IT band, tight rectus femoris, tight hamstrings, pronation, patella alta, a weak VMO, squinting patella, and lateral glide and lateral tilt of the patella.
Just to add on to that, CMP is the erosion of the inner surface of the patella cartilage, and this is one of the most common patellofemoral pain syndrome pathologies. So continuing on CMP, there's signs and symptoms. You're going to have the athlete or patient is going to show pain with squats. They're going to also have pain with sitting for long periods of time. They're going to have pain going down the stairs more than going up the stairs, and you're also going to feel a lot of crepitus in the knee. Special tests that you're going to want to do are the step-down test, the grind test, and you're going to look at McConnell's mechanisms as we stated previously. In the step-down test, you're going to see a lot of valgus force in the knee, and the heel is going to be popping up, as well as the trunk is going to have some side bend to it or a lateral shift. And they're also going to have a positive Trendelenburg sign.
Okay? Here are the different stages of chondromalacia patella. Stage 1 is when the edema of the superficial hyaline cartilage results in breakdown of the network of collagen fibers. Stage 2 is when the fibrillated cartilage and surface break the fibrillated cartilage and the surface breaks, then it extends to the layer of hyaline cartilage. Stage 3 is the break in the hyaline cartilage that extends to the deepest layer, almost to the depth of the subchondral bone. And stage 4 is the destruction of the hyaline cartilage with exposure of the bone, and this is indistinguishable from degenerative joint disease.
So to start on the examination for patellofemoral tracking issues, you're going to want to palpate the area verticinis to rule out any other possible pathologies. You're also going to want to rule out osteochondral fractures. You're going to want to determine any structural abnormalities, as we spoke earlier, so patella alta or baja or squinting patella. You're also going to want to look at your special test, as well as your muscle length and muscle testing. So again, as I stated previously, for the special test, you're going to want to do the grind test. You also want to do the apprehension test, which has to do with the patella, and to see if the patient is apprehensive while moving it. There's also the sweep test to check for swelling and compare bilaterally. Some of the functional tests, as I already stated, were the step-down test, as well as the squat test. There's another test you can do to check for tracking, and basically you can just have the patient move their knee into extension, and you're going to want to palpate the patella through the range of motion, so you can watch to see if it stutters and if it moves in that C formation.
When we're talking about patellar dislocations, the most common patella dislocations are lateral. Occurs most often with patella alta or frog-eyed patella. The mechanism of injury usually is a sudden forceful contraction that pulls the patella superiorly and laterally out of the femoral groove. When you're looking at an injury like this, the presentation will be that the patient will have the pain on the medial side of the knee with the lateral subluxation or dislocation. There's going to be obvious deformity. The edema will start to set in, and then there's going to be pain and apprehension with the apprehension test.
Some research that I found on patellar tracking problems are that you have a lot of problems with patella tracking being abnormal after surgeries have been done to the knee. As I said too, as well, there's a lot of dislocations that result in poor tracking, but dislocations can also create poor tracking after the injury has occurred. I found a research that showed that medial patellofemoral ligament reconstruction was done after a patella dislocation, and it showed that after the dislocation, the patella was not tracking normally through the range of motion. It actually had a lateral tilt to it through the entire range of motion. but after the surgery, the patella was tracking normally within the femoral groove. So, as they said that with surgery, you can have it can result with a lot of tracking problems, but it can actually fix the tracking problems, and that just it depends on what type of surgery it is.
So, in conclusion, poor patellar tracking is a problem that most people encounter sometime in their lives. Tracking issues are commonly due to overuse or repetitive injuries such as jumping, running, or kneeling activities. Structural and functional issues also predispose people to poor tracking. Dislocations can occur due to poor tracking or can create poor tracking once a dislocation has occurred. After any knee surgery, there is a chance there will now be poor patellar tracking. And then surgery of the medial patellofemoral ligament after a dislocation can be done to correct the poor tracking.
All right, so thanks for listening, and here are our references, and we'll see all of you guys next Monday. Thanks.
Thank you.